Hi, everybody. A warm welcome today from BEqualise again. I am extremely excited to be here today with Dr. Faisal Almubarak. Hi, Faisal. How are you?
Hi, how are you, Bibi?
I'm good. Thank you for joining us. So, just for the newcomers, a quick introduction. So, we are from BEqualise. BEqualise is a startup, the first holistic platform helping patients that suffer from dizziness and vestibular problem. And today, well, you know myself, I'm Vivi. I'm one of the founder, and today I am so happy to introduce you Faisal. Dr. Faisal Al-Mubarak is our expert in physical rehabilitation. And so today we're going to have a very interesting discussion about movements, the importance of rehabilitation for vestibular patients. So yeah, warm welcome. Thank you again for coming. And Faisal, so before we dive into the topic, I would like for everybody that is listening to us to know more about yourself. Who are you, your experience, and your huge expertise? So please tell us a bit more about you.
Thank you so much, Bibi, and I'm really happy to be with you guys today, and very honored to be one member of this great team. And we are here to help you guys, and inshallah, you will benefit from this, inshallah. My name is Faisal Al Mubarak. I'm a physical therapist by practice, and I have earned my master's degree in health service administration and my doctorate degree in physical therapy, specializing in vestibular rehabilitation. Vestibular rehabilitation is the rehabilitation where you ensure that you regain the functionality of the vestibular system after any attack, either central or peripheral. I've had an experience for more than, I would say, 20 years, and we see a lot of different dizzy patients and patients with vestibular disorders, and we are very proud that we made our patient to be back to their life and enjoy their quality of life. I've attended, I'm certified in also beside vestibular rehabilitation on the orthopedic manual therapy, as we have lot of different components in the orthopedic side that can affect or contribute to balance impairment and regaining balance functionality in the body. Also certified in the cervicogenic dizziness management, which is one of the causes of headache or dizziness that can affect people from the cervical region.
Great. And so you did your PhD in the US, right?
Yes. I
Nice.
did my
And
Doctor of Science in Loma Linda University.
what was
In the
the
United
focus
States.
of your PhD? Because I don't remember actually.
My thesis in the PhD was looking at the effect of jet lag
Oh,
on
wow.
balance. Yes. So
Nice.
yes. So jet lag is affecting physical performance, and we were looking at the effect of jet lag on people balance, posture stability.
Very interesting.
Yes.
Okay, fantastic. Thanks again, Faisal. Yes, so today I prepared a couple of topics that I believe all our users and future users and everybody that is joining slowly the BEqualise platform that we're trying to promote will actually benefit from. So, as you know, BEqualise, we are actually trying to help patients that have all sorts of vestibular problem. As you know, the vestibular is an umbrella term, and there are problems related to the periphery, which mean to the inner ear, and there are central problems which more integrated with the way the signals are integrated in the cerebellum and more, let's say, central the brain. So as a physical therapist, your understanding is very different from all the other team, and this is why I love to that we are all together in this. what is the role, in your opinion? How does balance is like, what's the role for you of balance, the role of balance in everyday life, and how important this is, apart from the pathogenic, apart from all the pathophysiology and the different disorders in general, just talking and explaining your point of view about balance. That's something that I believe is the foundation, and we should really clarify that. So just maybe explain a bit how balance works, because I believe a lot of people don't even know that. And maybe give us your opinion about the importance of balance.
Yes, yes, definitely. Well, let me start with the importance of balance. And I always like to discuss this whenever we discuss vestibular. I always ask people to back up a little bit, one step back, and look at the balance as a perspective and a comprehensive thing, because vestibular is part of the balance system, and it's assuring that the patient or the human body is balanced. So we have a static balance or we have a dynamic balance. So while I'm sitting right now here, I need to be balanced. Okay. And while I'm walking, running, or doing any activity, I need also to be balanced. But why I said we need to know the importance of balance? Because the opposite of balance is falling. Okay. So, and we need always to avoid falling, because falling, by the World Health Organization, is the second cause of unintentional death in the world. So it's just right after the road traffic accident. So you can imagine how many people dying from road traffic accidents. The balance is just right after that. So that's a huge number. And it's if you sit in an emergency room, and you will see a lot of people coming because of that. So balance is very important. Balance is very essential. Balance can be affected, as you said, by pathogenic issues to the body, or also can be affected by any external environment issues, such as any slippery floor, any tough or any dark room or whatever. So if we look at the balance system right now, we have our vision, our vestibular system in the inner ear, and our proprioception, which is the deep sensation that we have in the body or in the joints and in the muscles. So these three systems are working together to communicate with the brain to tell exactly what is Faisal, for example, is doing. Like, for example, now, if I look to the right for 45 degrees, the vision will say to the brain that Faisal has looked 45 degrees to the right. The proprioception, the sensation in my joint and my muscles, will also tell the brain that Faisal has looked 45 degrees to the right. The vestibular system as well will say that. So if there is any issue in one of these systems, will be a mismatch between whatever is saying by this system that has the issue and the other system. And the
Yeah,
brain will be confused, and this where we will have dizziness, and that
exactly.
will come out to affect the balance in general.
Exactly. So this is always very important point that I'm so glad you raised, that we need to always strengthen and explain the patients that the balance is a multi-sensory integrations of signals, meaning that you have so many signals from the afferents, from the inner ear, from the eyes, from the ocular motor, as is described, from so many aspects, and they all get integrated back into the vestibular nuclei in the brain, whatever. And this is so important to explain, because whenever you have some faulty mechanism, either one of the signals that it's sent is faulty, either there is a mismatch of the integration, that's when the pathophysiology and the problems are actually occurring. So I'm very glad that you explained this. So hopefully this is a bit more clear. Now, going back of the fact that it's so complex and that we have a multisensory integration, this is where movement is key, because we need to train every aspects of our life. We need to train our eyes, we need to train the way we move our head and your proprioceptors, so all over your body. And I believe this is where the role of physical therapy can really make a huge difference, because If we look now more into the pathophysiology, one of the common traits of vestibular patients, aside if you have one disorder or the other, it's that you get the fear of moving, because this integration that we describe, it's very complex. And of course, one of the first things you want to do when you're not feeling stable is trying to control yourself. So you hold yourself, you don't want to move, because every time you move, this integration is faulty and makes you feel bad. So this where rehabilitation, I believe, has this huge role to push people back into functioning in a three-dimensional space, right? So,
Yes.
and in your experience now, more into just for everybody that is following us that unfortunately does suffer from a vestibular disorder, when you think about rehabilitations, what would be kind of like the key things that you want the patients to know about when they have any sorts of vestibular problem, any imbalances? What will be for you a way to explain them that vestibular rehabilitation is a key component in their recovery journey?
Excellent. So definitely, first thing we always is good to know where they stand, the baseline. Okay, and one of the most important baseline that I want to know is their confidence level. We measure their confidence level. Okay, because people are, as you said, they have fear of doing things. And I had patients. I saw that they had a chronic dizziness, and it's gone, but they cannot function not because of any pathology. It's because that they have fear.
Sure.
And once that fear gone, they start to move. Exactly. So one thing is to measure their confidence. So, and to be honest, number one thing that always vestibular patient is looking for is people to hear them and to understand them, because they always go to doctors or they go to some places and they say you are fine, your lab work is good, your x-ray, your radiology, whatever, MRI, CT is good, you're fine, but they are suffering. They are suffering. So when you sit with them and when you talk to them, so history and talking to patient is number one thing that you really need to know in details about this patient. Second thing, you need to know exactly what are the things. So there is something that we call ICF model, the International Classification of Function and Impairment. So I want to look at this patient as a whole, as a comprehensive. I want to know what is the pathology, and I want to know what kind of impairment that is caused because of this pathology, and what kind of activities that this patient cannot do because of this impairment, and what are the other things that this patient cannot participate in because of losing this activity, and what are the other social and personal factors that is affecting this patient. I need to look at this patient as a whole. One person, one of my friends always saying that when you are in the clinic, you don't have an ear coming to the clinic, you have a whole body coming
Sure.
to the clinic. So
This
you
is
want to
very
make sure.
And I'd like
Exactly.
to add one more. This is essential, and this is also what we're trying to pursue in BEqualise with this holistic approach of looking at the person as a whole. But the one thing you mentioned that is extremely important to, I believe, emphasize about the fact that fear.
Yes.
In vestibular disorders, and this is what I've also done during my PhD postdoc, and especially certain disorders, we don't have biomarkers. So sometimes you do go and try to find something that can actually indicate a pathological state, but you can't, because functionally or through an MRI, everything seems normal. So this is again a big challenge for medicine, that we like to categorize everything. It's that sometimes with the vestibular system, you have this very gray area where the patient looks functionally fine, in terms of objective biomarkers is fine, but they still have the dizziness and they still report the dizziness. And this is what we are trying to look beyond. And we're trying, especially with the app, to say, okay, yeah, maybe you have this pathology, maybe not, but these are the things you can do today in your hands, because the psychological component is massive. And one of the reasons why it's so massive is that, as we all know, We have between the 2 years, we have one thing, the brain. So
Yes,
even if
yes.
we try, there is the brain in the between, and it integrates everything. So if there is a mismatch of this multisensory integration that we said before, those they also go through the multisensory dimensions of the brain, meaning that the vestibular nuclei, we know they're communicating also with the limbic system, with the emotional system, with the amygdala, and so on. So there is this very key aspect that sometimes I believe in the clinical practice there is not enough time to dig into with the patients. So what is holding them back? And I'm so glad that you raised that, because I believe this could resonate with a lot of the patients that are looking at us. Please continue. I'm sorry if I interrupt you.
No, no, no. Thank you so much for raising this. And the body balance, the body system is very smart, and the vestibular system is very smart. So if you happen to have any simple infection in the ear, okay, you might have this imbalance because of this infection. Sometimes there is no need of an interfere from a vestibular rehab therapist, but sometimes there are a need. So one day I had a patient who's 20 years old who had only an infection, a simple infection in the ear. So he had pain and dizziness. He went to the doctor, he treated that infection with antibiotic, 7 days, no pain, but he was still imbalanced. And this 20 years old was healthy. His dad was taking him, walking with him because he wasn't be able to be balanced. Okay? So in 2 week time, 2 week time, this patient was coming back to me driving his car. So we want to think of the vestibular system as, for example, let's say that you have a broken arm, or someone has a broken leg, and it was in a cast for 1 month or 2 months. So this bone is healed, but after being in a cast for 1 month or 2 months, you need to train these muscles to be able to continue its strength and its coordination so it can function again. It's the same thing happening to the vestibular system. The vestibular system, if there is any pathology affecting that vestibular system, you need to fix that pathology first. And then you need to train the vestibular system to regain its own functionality. Okay? And let me add one thing here, very important. Why the vestibular system is very smart? Because one important role of the vestibular system is what we call the vestibular ocular reflex, the VOR. So the VOR is the relationship between the eye movement and the head movement. And I always ask people, I said, if I put my finger in front of me now and I look at the finger and I move my head right and left and my eye is looking at the finger, is my eye fixed or moving? So some people will say it's moving, some people will say it's fixed. It is moving, but it is moving in a different direction, but with the same speed and the same angle. Why? Just to assure and to give the human body the gaze stability. So this is one key thing, or one of the way of doing a rehabilitation to the vestibular system is by doing a VOR exercises. So why, again, I said vestibular system is very smart, because in your daily life, you are working in your VOR. You are walking, you are trying to concentrate on one thing while your body is moving. That's why it can be regained by itself.
Yeah.
But
And
sometimes,
yeah, and one of the things is exactly to try maybe to explain to the patients that have sometimes they are skeptical about physical rehabilitation, or they have bad experiences. They don't find any improvement. This does happen sometimes. The patients are referred to physical therapists, but they are not specialized in vestibular medicine, so they let them do something. The patient doesn't feel better, actually aggravate the symptom, feel worse, and then they don't believe in physical rehabilitation. But what you just mentioned, actually, this is the point, is that because the system, as we mentioned at the beginning, is so complex, you need to train everything. The eyes, the neck, the proprioceptors, the integration. You have to look at all aspects of movement. This is vestibular rehabilitation. And this is where I believe you can make a difference in the treatment plan of a vestibular patient, because just by knowing what the patient needs and where is the deficit after checking the baseline, you can intervene and give them the right amount of stimulation so that the brain fine-tunes and rehabilitates, like does his muscles, does his ups, does his exercises, and goes back to normal, right? So
Yeah, I agree. I agree. And one thing that is always important is to progress with the case. So there can be an improvement, but is it the improvement that is allowing this patient to do his or her job? Like, for example, I have a different line of care for different people. Like, if I have a patient coming with a knee injury who is, let's say, a doctor working in a hospital, and I have another patient coming to me with the same knee injury, but he's an athlete playing soccer, I
sure.
would definitely have a different line of care for both of them, because I need to prepare this person to be back and to do aggressive and very advanced athletic work. But at the same time, the other person is only a doctor who wants to just go back and walk and run and jog a little bit, right? So, and also the body was, built and, ready for this kind of thing before, because he was an athlete before, he was not an athlete before. My point here is, when I have a patient coming to me, I need to know, what are their occupation. Why? Because I want to know during the treatment about things that I would ask them to avoid doing or to continue doing. Okay?
Mhm.
Because safety, safety, safety. Safety is always number one thing for us.
Sure.
Correct? And after that, I need to know their occupation so I can be able to prepare them for that after that. So I can, let's say, I have a weak arm and I was barely holding a 5 kg, but I continued training until I managed to do 10 kg. Okay, it's managed, right? But am I able to do my job, which is to work in a store where I can carry some boxes? No. So the point is, you have to work with your patient until they are to the level of being able to do a specific skill or a specific job freely, safely, and smoothly.
And this goes exactly as a parallel for the muscles of the brain, exactly the same, because
Yes.
it's also a muscles. Okay, that's fantastic. Now, if we dig a bit more into the vestibular pathologies, just so that everybody knows, in BEqualise, now we released last week one of our first version that we're validating, but there's going to be more to come, and we're focusing on more and more pathologies. But for now, we have peripheral and essential. So, what will be for both, in your opinion, one of the key advices that we can give patients today at home, apart from, okay, download the app, figure it out, that we are actually giving exercises? What would be something that for you would be happy in general, as a general guideline for patients that suffer from imbalances, that you would recommend to them? What will be your number one tip, let's say?
Well, always be safe.
Mm-hmm.
Always try to seek a specialized person who is able to seek and to know exactly what is the thing that you are suffering from. Once you know the issue, and once you are safe, you will be going, inshallah, in the right track. And I always ask my colleagues in the healthcare profession, I say, you know vestibular patients are fragile.
Mm-hmm.
Okay, if you don't know how to deal with them,
You make a
don't,
mess. I agree.
don't touch them.
I
So
agree.
Yeah. So, and you also, as a patient, if you suffer from a vestibular issue or from a dizziness, you should seek someone who's specialized in this. I
in
think
this.
that's one thing that they have to do.
100%. And one more thing I'd like to add, if you are in acute, you definitely need medical attention. But if you are in a chronic state, meaning that you had an episode, you had whatever, and now you're trying to live with it, but you're not 100% okay. One of the big messages that I believe in BEqualise we're trying to push on 360 degrees is like, look at your lifestyle, because this is number one thing you can do, that it's in the power of your hands. And move, meaning that maybe one day you can barely do a few steps and you have to be assisted, but then you start walking again. And moving for me, movement is key for most people. Because even for the one that suffer from chronic dizziness, from the vestibular migraine patient's perspective, from the PPD, from anybody, at least the walking, the moving, the engagement of trying to be less sedentary. I have a kind of like a war. I'm doing a war to the sedentary lifestyle because all of us we're victim of this. Apart if you're patients or not, we're all seated all day. And for me, this is one of the biggest problems, because when we look at the statistics and what's happening in the world, really, human beings are not made to be seated all day. We're made to move, we're made to function, we're made to move in a 360 degrees space, but we're always, nowadays, we're all often completely just seated all the time. So this is very important. And the lifestyle, as we mentioned. Okay, so in terms of maybe, I don't know if you want to dig a bit more on what will be, in your opinion, also something that patients with peripheral problem, actually, more than central. Let's focus now a little bit on the peripheral. What are, just so that they know, for the patient that unfortunately are still in the journey of recovery and maybe they lose a bit of hope, what are the steps in the rehabilitation? Because I think this is important to explain them that yes, you have amazing day, but you can have relapse. You can have days that you don't feel great, but you need to. There is a journey that the patient needs to do, right, in the rehabilitation, and that sometimes it does take months, or it's not a one day you go get fixed. So maybe you can tell us a bit more about this and your experience with peripheral patients.
Yes. Again, so I always tell patients, you mentioned a very important thing here about acute dizziness and to seek for medical attention. So I always tell people that dizziness is a sign. It's not a disorder or it's not a pathology. It's a sign, and it's like pain. So when you have a pain, you can have a pain because of many different reasons, correct? So when you have dizziness, this dizziness can be caused because of many different causes. So you have to seek if you have an acute dizziness, you have to seek medical attention first, just to clear out and to know exactly that you don't have something critical. All right, so that's number one thing. Number two thing is for the peripheral, as you said. I always make sure that so the vestibular management, as you said, it's a comprehensive approach. And the great thing, I'm not only saying this because of BEqualise, the great thing about BEqualise is that we all are here together to see the patient. So patient-centered approach. We are all around the patient just to make sure that we cover all needed aspects. Because I cannot do physical therapy if there is any other factor that is affecting the patient.
Sure.
Make it worse. Okay, so I need to know, for example, one thing that the cause of this is gone. So, for example, let's say you have an infection, you are cured from the infection. You have any other different pathology, you are managed in this pathology.
In the acute, yeah, that's number one. I agree.
Exactly. Second thing is you go gradually, and in here we have some challenge. But always communication is very important, and educating the patient is very important in here, because patients, again, all vestibular patients are frustrated, and they always want something that can take them to the right or the safe side. So you tell them this would need time, so you have to bear with us, okay? This can provoke some symptoms, okay?
This is
Provoke,
very important because a lot of the time when they go, also in our app, we do have the disclaimer. When you start the exercises, guys, you might not feel great. And some of the days you feel, okay, this is not for me. You can step down, but there is as you mentioned, you need to keep going. It's gradual, but the stimuli needs to
yes,
be there.
yes, day by day. So I always, so one day a patient came to me and he said, you know, when I do this exercises, I feel dizzy. I said, yes,
That's the
it's
purpose.
provoked.
That's the idea.
And exactly. So the second day he would come, or the third, or after 1 week or 2 weeks, he would say, or after 1 week, he would say, I still feel dizzy. But I asked him on the other side, how long it took you to be dizzy. So before, once you move your head, you become dizzy. Now, so maybe for example, they're not dizzy anymore from sitting position. So I
Yeah.
progress and I ask them to do it in a standing position. And I progress and I ask them to do it from standing on a foam surface. And you know, as we
This,
progress.
yeah, and this is also maybe something we should also explain in vestibular rehabilitation. And sometimes, in order to get better, you have to get worse, which means the some, not always, but you have these provoking type of exercises. Which again, if we make the parallel with muscles and gym, is like the burning sensation of a muscles when you're lifting weights. Not very pleasant. You don't want to do it the day after you have pain, but you have to keep doing to get stronger. Exactly the same with the vestibular system. You might get dizzy, you might not like the sensation, you feel it, but if you keep doing, you get better. This is also very, very important because some people get so afraid whenever they feel unbalanced by having a provocative exercise that they want to stop. They freak out. They're like, oh my God, why would I do this to myself? Why would I make myself
Yes.
more busy? And actually, you should, which is, I
Yes.
know it's not pleasant, but it's the way to go through, right? So,
Exactly. And we don't want you to be disabled, correct?
100%.
Because some people, this can lead them to disability, this can lead them to not move, this can lead them to gain
So,
weight, this can lead them to have weak muscles, this can lead them to do a lot of things. Then you might have a lot of different issues coming to you that
yeah,
you
from
were.
different angles, 100%.
So definitely, you
Nice.
know, I
I,
always like to make people compare, even compare. I ask them, compare your life now. You are here to me now. You came to me 1 week ago.
mhm.
Because some people, you really want to direct them, okay? And you want to emphasize sometimes. They say, Doctor, I've been here with you for 1 week, but I still have dizziness, okay?
1 week.
But I ask them this question. I say, how was your functionality in your day life
Yeah.
1 week ago, and how is it now? They start to think for a bit and they say, no, it's better. And I said,
Nice.
yes, it's not a matter of you still have the business, it's the matter that how is your life now and where we are going now.
Exactly.
So
And
that's
this quantification, we also do it with trigger. So again, use the app. I'm not saying it to promote the app, but it's useful, to be honest. That's why we did it. It's that you can use the app to quantify your trigger. So if you see that this is triggering you, like going to a supermarket for the patients that have visual induced dizziness, they don't want to go, they get overwhelmed. Again, there is a mismatch of sensory integration, they don't like it. So they can actually say, day one, I feel terrible. But then maybe by rehabilitating, after 3 weeks, they don't have 10 anymore, they get to 6, 4, and so on. So quantification is really, really key. I agree. Now, if we talk about central, Faisal, central is much more challenging. We know that nobody understands it. Still, we do research. I spent years doing research, and I'm still doing it. I'm very happy, actually. I will tell you more, but I'm gonna continue doing research on MDDS as well with my old university where I did my PhD. So I'm very, very
So,
excited because we need research. But when we
yes.
think about the central, so maybe something for the central patients that they are not so functionally impaired, like they are functionally impaired, but they are not impaired in a way that you can quantify it. Again, why physical therapy and in general movement can still help them? What do you think?
The role
What?
of physical therapy is even very critical and more important with the central region. Because if you have a patient, it depends on the and where in the central region is the effect. So people can be impaired with different things. Their vision can be impaired. Their, you know, some,
Different, different
you
parts of
know,
physiology. Yes, we are not
example.
saying, yeah.
So for example, so I had patient who had a stroke, for example, and who went to some non-specialized physical therapists in the vestibular rehabilitation. So the patient would come and say, they are strong in their muscles, their sensation is good, and they can talk, and but they can't be balanced because no one looked at this component of balance. Okay, no one looked at. So as again, we have, I always call it an equation. Remember the first thing we talk: the balance, the vision, the vestibular system, the proprioception, the brain, and the motor output. I call it the equation of balance. So I always like to look at this equation and I see what is missing in this equation for me to have a conclusion of balance. And I always go back and fix, because now you might have a weak vestibular system, but you have a strong vision and a strong proprioception. So you can have these two supporting you to regain the functionality that you have. But we need to know one thing also,
Mhm.
that in central lesion guys, and looking at the rehabilitation in general, you cannot always bring patient back to full independence. You cannot bring the patient always back to
This
their
is,
normal.
yeah, these are more for the strokes component, let's say. But when I was more talking about central, like vestibular migraine or this type of problem. This
Yeah.
is, but I agree 100%. There are so many aspects of the vestibular that can be applied because we have vestibular problem in so many neurological disorders as well, right? Not just
Yeah.
the vestibular problem, but also the stroke, the Parkinson, and I mean, it's broad. But one of the things, as you mentioned, is yes, to look at this aspect regardless of whatever central problem and underlying etiology you have. And would you agree that maybe central patients more, even more than the peripheral one, they really need to take care um, of the whole component? I'll make an example. In vestibular central pathologies, if you have PUPD, you have migraine, vestibular migraine. If you have many of the vestibular central disorders in functionality, you always have an underlying migraine. And we know the migraine, you cannot do much unless you take care of your lifestyle. So maybe
Yes.
this is even more important, right? That they will understand that vestibular rehabilitation is like one of the key aspects, and around there is a whole journey that they need to do on themselves, right?
Correct. Correct. The body system again is very smart. So if you allow the body system to take care of itself.
Mm.
And why I say allow? When I say allow the body system, is to give the body system what it needs, in terms of lifestyle, food,
Yeah.
stress relief, movements, all this kind of thing will definitely build and support the other system in the body to be regained. And
100%.
it's about mindset, you know. Even the joints have their, you know, I keep saying that the joints, they have brain. So if you don't move them, they will forget what
It's
they.
true. Muscles memory and everything. I agree. Thank you, Faisal. This has been very, very insightful and I think very useful for new vestibular patients. I think we have a couple of questions from our users. Let's see
Thanks.
before we wrap up if we have any. They should appear. Okay. Why is movement so important for vestibular patients? Okay. Yeah, we kind of touched base on that, but please, maybe you can just give it an answer.
So again, as we said, the vestibular patients, the movements is moving the muscles, the joints, the body. The vestibular system will be interacting with the whole external and internal systems. So it will help communicate between the different systems in the body to be regained the functionality. I always, you know, like to call them as a gang, you know. You know, they go together. Okay, so if they keep moving, whoever is not there will come to them and keep moving with them. But if they're not moving, they will all be not moving, right? So I always advise people to start moving and to moving safely. Of
Mm.
course, moving safely.
Always
So
safely.
yes, moving, and this will help, you know, the body to regain its own functionality by itself.
Okay, thank you. One more thing, maybe just to mention, is why we're able to regain functionality on ourselves is because we have neuroplasticity and our brain is amazing. So we can
Yes.
rely on that, guys. So even whenever you have, even patients with unilateral vestibular loss, imagine they can regain, which means that the brain has this amazing capacity to kind of rewire up. And hopefully, this is a message to give a bit of hope to the patients that they feel really down and they feel like, okay, I cannot. No, you can. You just need to allow yourself to have time and the right input. We might have another question. Let me just check. Okay, we do. Hi, I'm Julie. I'm 43. After how many months will I start to feel better if I start vestibular rehabilitation program? Okay, this is a tough question because she didn't mention the pathology, but maybe we can give something roughly.
Well, you know, it depends. So again, from a peripheral to a central is different. Some peripheral, it's a week time maybe. Some will take 2 months. So that would be, you know, it depends on the case of this patient. So we treat each case, you know, individually.
Individually, personalized approach. Okay, fantastic.
Yes.
Okay, I think we can wrap up. Just for maybe Faisal, I don't know if I mentioned anything useful for our users downloading the app, and also they can reach you through the app as well if you want to have consultation with you. And maybe you can, I don't know, mention whatever you want as the key message for the patient following and downloading BEqualise and willing to get better.
Well, I think number one thing that they have to do is download the app just to see me, okay? And and
Otherwise,
and please, you know, I'm not advocating this app because of I'm a member of this app. No, it's because wherever you are in this world, you can approach us. And this is one of the things that people always suffer from is or they don't have access to specialized people in vestibular pathology. We are here for you. You can download the app. You can learn from a lot of educational and a lot of videos that we have in this app. You can approach us through this app. We can make an individual and personalized one-to-one communication with you if you have any question, if you have anything that you want to discuss. You know, vestibular system is very small system in your body, but if it's has an issue, the whole body will be
collab.
affected, and you will, the quality of life. You know, I've had an experience myself, so I know exactly
You know,
how.
I always like to mention, to go back to embryology, the vestibular system is one of those primary systems, and is also one of those primary systems that pretty much every living, from even insect, animals, smaller, not just mammals, everything on Earth has a gyroscope, a vestibular system. Why? Because you need to orient yourself. You need to know where gravity is. You need to have this vector, this gravitational vector, to know where you stand in space. So imagine it's a tiny little thing, but it's making a big difference in the life,
Yes.
even in evolution, in everybody. It's a key component for our understanding of reality. And I believe this is probably why so many patients that whenever this losing of balance, let's say, for whatever reason, that's why the fear and the frightening, because it's a primary component of our understanding of reality. And whenever you don't feel you are walking straight, you lose your whole sense of where you stand in space, and you lose your sense of self, kind of. So I'm very, very, very happy, and I'm so grateful, Faisal, that I've met you today and that you shared this knowledge and time with us.
Same,
Um,
same here. Thank you so much. Thank you for your time. And I
Thank you so
hope
much.
we present something useful to the community.
Exactly, me too. And please, comments, guys, anything you want to see next. We are here to help you. So just let us know. Thank you so much. And we'll see each other soon. Thank you. Bye. Thank you.